Welcome to North of 60. I'm Heidi Schweighofer. It's fall here in Ohio, and that must mean Medicare season, and I'm sure that you are being inundated in your mailbox with every kind of advertising known to man for various plans. Today, though, we're going to talk more specifically about Medicare Advantage plans. My guest is Rich Waldron. Rich has been in healthcare for over 30 years. He was an attorney, or might still be an attorney.
Still an attorney.
He was a senior leader with Medical Mutual of Ohio. He worked on the Ohio government transition team for healthcare under John Kasich. And now he is president of Devoted Health, which is an Advantage plan new to Ohio. Thank you, Rich, so much. I apologize about the attorney business. My husband's an attorney, and I think, gosh, are you going to be an attorney forever?
I won't give up that ticket. That was a lot of hard work to get there, but I don't work as an attorney any longer.
All right. Well, I want to, before we start sort of a more generic subject, I want to say that I read that your company was in the 2020 Forbes Best Startup Employer. What a distinguished list to be on. What were the factors that made that decision? Do you know?
I know that and really proud of the company for achieving that, so thank you for pointing it out, Heidi. Forbes looked at a lot of different factors, but I would say probably the biggest factor was how the employees felt about the company. And when you look at a company like Devoted, it comes down to mission. The company has a very simple mission. It is to treat our members like they are people we love, like our family members, like mom and dad. And that ends up really being motivating. People feel good about doing that job.
Yeah.
And so when the employees are happy, you score well, you become a really popular best startup employer.
Oh, I think that's excellent. That's nice to know. When were you founded, and are you locally owned? Your website said you were new to Ohio.
Yes. The company was formed in 2017 by two brothers who happened to be from Ohio.
No kidding.
But they didn't found it here. They founded it, the one lives in Boston, Massachusetts, so they founded it in a suburb called Waltham, and that's where the headquarters is. We first started selling Medicare Advantage plans in 2018 in Florida. We've since expanded to Texas, and this year we're new to Ohio because we're starting to sell policies in Ohio this fall for a January effective date, and we're also at the same time entering Arizona.
So do you anticipate in 5 years you might be able to offer these plans in almost every state? Is that the goal, or is it just to stay sort of regionalized?
I think it's likely that we will cover not just every state, but with a mission like Devoted's, I'm hoping we change
Conquer the
healthcare
world.
all over the world. I won't go to universe, maybe we'll stay with the world.
Excellent. Well, all right, so this is what you had to teach me, and I'm glad you did. You had to talk to me or email me about the difference between a Medicare Advantage plan and a Medicare supplemental plan. And I would really like you to state that again and talk about the differences.
Sure. Probably the easiest place to start is by thinking about traditional Medicare as a government plan that was started back in the 1960s. The government realized that seniors were pretty vulnerable. Many of them, once they stopped working, didn't have any way to pay for health care. And people were living longer, and it was really a problem in America. So this governmental plan was formed called Medicare, and it's insurance provided by the federal government. Around in the 1990s, the Medicare started to realize it wasn't the most efficient program in the world, and it wasn't making people all that happy. It didn't have high service levels, and it thought potentially it could be better by letting Medicare Advantage grow. Medicare Advantage is a program that lets private insurers be a replacement for the government plan. So if you're with the government plan, you have very large deductibles and coinsurance in addition to your premiums. So frequently you'll buy a Medicare supplemental policy to help with those extra costs. If you decide not to do that, if you decide to leave the government plan, you can buy a private plan from a company like Devoted. called Medicare Advantage, and then all of your health care needs, whatever the government was providing, a Medicare Advantage plan has to also cover. But the Medicare Advantage plan is also required to add supplemental benefits to that, to deliver more than the government does. So for example, at Devoted, we, and many other Medicare Advantage plans do this, provide dental and vision coverage, provide coverage for hearing aids, things that the government program doesn't provide.
That's very true. I have a supplemental plan, and we had to purchase extra vision, extra dental.
Yes.
We don't need a hearing aid yet, but at some point they're very expensive.
Very expensive. In fact, for those of your viewers who are concerned about hearing aids, we've done a very unusual thing with our benefits. We've actually moved away from putting a copay on the hearing aid, because basically they're so expensive that you end up paying for the whole thing. We actually cover most of the cost of even the most expensive hearing aids, and then you just have your set copay amount, as opposed to a set dollar threshold that only covers some small portion of it that so many plans would cover. So we know that that's an expense and try to take care of it. Yeah. And that's common. Medicare Advantage plans are trying to differentiate themselves, so you look for those opportunities to go above and beyond.
So it's a private company that has replaced Medicare for those who purchase it.
Exactly.
And, okay. You know, there's now the parts A, B, C, D,
yeah.
E. I don't even, I heard a G. I'm truly not, I need you to explain those for me.
I will, but before we do the alphabet soup, I'd also mention, when we talk about purchasing Medicare Advantage, in many cases, there are zero premiums associated with these Medicare Advantage plans, and I'll explain why in just a sec.
All right.
But plans differ in how much premium they have, and many of them are even zero premium. The alphabet soup, let's start with A and B. Part A is basically the portion of Medicare that covers facilities like hospitals and skilled nursing centers. Part B is what pays doctor bills. So whether you go to see your primary care doctor or a neurologist or a gastroenterologist, that's Part B. For some reason, we couldn't just go A, B, C. We had to skip over to D for prescription drug coverage. And in between A, B, and D is Part C, and that's the laws that enable Medicare Advantage to be in existence. So Part C covers Medicare Advantage and isn't a separate type of health care that it's covering.
I didn't know that.
So we're C, covering A, B, and D.
Is there anything past D? Or why did I somewhere hear a G? But maybe it was in my head.
No, I think those letters are used less around a type of healthcare, a slice of healthcare, like, for example, drug. Those other letters are sometimes used around Medicare supplemental plans that talk about plan types. And so I know there is a Plan G, there's a number of those Medicare supplemental plans. By the way, Devoted doesn't sell Medicare supplemental plans, so I haven't really gotten that deeply into it.
And that's fine. That's fine. I haven't either, to be very honest. We use what we use, and we thank heavens haven't had to deal with any catastrophes at this point that we have to deal with our insurance. So I know I want to talk about vision dental because it's such a big deal and it can be so expensive, and other perks. A friend of mine said she gets 45 free massages a year or something from her Advantage plan, and I thought, oh, I would love something like that.
That is a nice perk.
So let's talk about the vision dental and perks.
Sure. So I'll start with this thought. Many Medicare Advantage plans, because they're looking to provide supplemental benefits, like to go first to vision and dental coverage. And the reason is pretty straightforward. If your members are taking care of their eyes, their vision, their dental needs, they're going to make themselves healthier and happier, and that's the goal of a Medicare Advantage plan. In the end, Medicare Advantage plans are all rated, and the most important thing a Medicare Advantage plan can do is be highly rated.
By whom?
By the federal government. The Center for Medicare and Medicaid Services does ratings of plans. And to earn a high rating, you want your members to be very happy. You obviously want them to be healthy. That's good for you, it's good for them, it's why you're in business. And vision and dental are good examples of a kind of coverage that, while it can be expensive to provide it, if you provide it bundled in with the larger plan, people will end up being healthier and happier, and that's the goal. Other perks, one of the most common ones you'll hear about is silver sneakers.
I do hear about that.
I hear about that all the time. Basically a program for fitness and health, wellness. In addition to that, Devoted has said, let's go above and beyond even what Silver Sneakers does. We actually give our members an amount of money each year. It can range from between $150 to $300 a year that is yours to spend on things like yoga mats or dumbbells. You can actually get an Apple Watch if that's to your liking. Spend the money on that, because we believe that you should have some of your own authority to take care of yourself, and that tends to make people happy too.
What an excellent idea. It truly is. You're really promoting wellness in all of these areas for seniors.
Another thing I'd mention, and this again, not unique to Devoted, but it's a good story that tells you how a company can do a good job for the citizens who choose the plan. When COVID hit, Devoted not only was concerned about its members and took the effort of calling all the members, and I could tell you some of the most heartwarming stories about these phone calls. People have developed real relationships with the guides who call them. We call our folks guides who reach out to the members because they help them navigate the system. But we actually got concerned that some of our seniors, when we called them, were not eating. They weren't able to get out to the grocery.
That is very true.
So we've actually been providing a service where we'll help you we will reimburse you for the cost of having groceries delivered to your home, because we're so concerned that if you don't eat, you'll get sick. It ends up costing us money, but it's not to save the money, it's just the right thing to do.
Excellent idea. I can vouch for that here in Hudson. There were, especially in the spring, and I would say almost before now, before fall hit, that people were very concerned about the number of folks who absolutely would not leave their homes. They were scared to.
Absolutely.
And going to the grocery store was just one of those trips that was too frightening. Yeah,
I'll tell you a story if I might, and I hope this doesn't take too long. But
I love stories.
It's a story that really warms your heart. One of the first people we called was a gentleman who said, I feel fine, thank you for calling. But I haven't eaten in 4 days. I don't know how to get food. And we said, well, we'll help arrange for you to get groceries delivered. And he said, no, you won't, because where I live, there are no groceries that deliver here. So we actually have arranged to buy groceries, have them delivered to the local sheriff, and the sheriff brings them to his house.
So he can check on the gentleman also?
Yep.
Oh my gosh, that's really very, very nice to do that. I like stories like reaching out. I truly do. Rich, so there have to be some restrictions with Medicare Advantage plans. Let's talk about the restrictions, and then I want to talk a little bit about the money part of things.
The two primary restrictions you'll see in a Medicare Advantage plan, first one is networks, which doctors and hospitals are in your network, whereas traditional Medicare, almost all hospitals and doctors will take Medicare. Not totally all, because some of them actually don't qualify. They might have problems with their work history or whatever, but generally all hospitals and doctors will be available to you. Most Medicare Advantage plans work on a network. Because they're a private company, the hospital or the doctor can choose whether or not to contract. So networks might be restrictive. Now, Devoted and many other MA plans tend to have very broad networks. But some Medicare Advantage plans work on a much narrower network basis. So that's one restriction to be aware of. A second one has to do with referrals. So some health plans require that before you go to any specialist, unless it's an emergency, that you get a referral from your primary care doctor. In Ohio, well, Devoted doesn't require referrals, but there are a few exceptions to that. Speech therapy, some certain therapies where we would ask you to go to your primary care doctor first. But those are the two main restrictions.
So then, if I were to sit down with you and look at your plan, I would want to look first, it sounds like, on where my doctors are, if you cover the places my doctors are. If not, that means I switch physicians?
Well, yes, that's true. One of the things that we were talking about before we started here with the program was which doctors. So, like, Devoted does a very unusual thing in the way it builds networks. After 30 years in this business, I didn't think I'd be surprised by how you might go about thinking about networks. What we've done is we actually start with finding the very best primary care doctors we can. And as you and I were talking about beforehand, Ohio is really blessed.
Oh,
the doctors in this community, not just here in Hudson, but really all across northern Ohio, are exceptional. And around here, you might hear doctors associated with Unity Health Network, or Community Healthcare is down in Canton. These are remarkable practices that locally you'd think, oh, they're good doctors. But I work across the nation with doctors, and I would tell you these are among the best of the best. So we start with those doctors, and we want people to know how great they are, and we ask you to choose one of them as a primary care doctor, or a doctor maybe with the Cleveland Clinic, for example, because they're in our network too, or University Hospitals is in our network. You can pick those doctors, and then from there we build out the network with specialists who those doctors tell us are great. Those doctors tell us will take good care of people. So it's a fine place to start to see if your doctors are on the network. But I hope that people will take a little broader look and say, if my doctor isn't on the network, is there a reason for maybe thinking differently about a change?
Okay.
And maybe we can talk a little bit about how you might make that decision and getting some expert advice on that.
I think it's hard for an older person to think about changing physicians. Sometimes, you know, I think about my parents were with the same doctor for, oh my Lord, 40 years. Yes. Then he retired, and they never quite liked the replacement, even though they then saw the replacement for 30 years. And I think that's probably, maybe not for me or for my husband at this point, but sort of a scary thought of, oh, I might have to leave this doctor I've seen now for 10 years and start with someone new.
Yes. It's one of the reasons why we at Devoted chose to have a very broad network.
Yes.
Because change is hard, and to the degree that we can keep people with doctors who they know and trust and who not only care about them, but they care about the doctor, that's a recipe for success. But if one is thinking of a change, they say, boy, that plan is really so wonderful. I want all those extras that Devoted can give me. I want those guides who are like professional sons and daughters taking care of me. I want all the wrap of love and affection that they're going to give me. If I have to make a change, maybe I still want it. Then what we'll do is talk about how can we help you get to somebody who will give you that love and attention.
Okay. Same thing with vision and dental. You have networks for them as well.
We
so
do.
One would, that's easier, I think, frankly, to do with.
Yes, it is.
I don't think people get that, fond of.
They're optometrists.
Yes.
Although one of my good friends is an optometrist, and I know Susan would appreciate it if I would put in a pitch for her. But no, I agree with you. That's not as momentous a decision.
Let's talk a little bit about cost of things. Now, I know that you are going to talk about Devoted's cost, but if you can broaden that to talk about, in general, Advantage plans cost.
Yep.
I know with supplementals, we pay out of pocket every month, in addition to Medicare coming out of Social Security.
Yep.
Okay.
So the main cost with any insurance is the premium. And to be, when you're eligible for Medicare, you get Part A without paying a premium, but you pay a Part B premium. And there's no avoiding that. That's what you're going to have to spend, whether you're in Medicare Advantage or just traditional Medicare. Most Medicare Advantage plans, I think it's the majority of them, are zero premium. They don't charge extra premium to you. The government gives the Medicare Advantage plan enough money, it says it's enough money to cover any person, and that's the money that the Medicare Advantage plan works from. if there are copays and deductibles, they tend not to be very large because Medicare Advantage plans don't rely on that as a way to float the boat, if you will. They mostly are there to make sure you have an incentive to, for instance, go to your primary care and not just wander around to other providers. You know, stay inside those people who, for instance, have your medical records and know how to treat you.
Right.
So there's not a lot of extra costs with most Medicare Advantage plans. I will talk about the devoted plan just maybe because the 3 plans, because they're illustrative of how this process works. So we have a plan that's a core plan that's like a lot of these Medicare Advantage plans that have 0 premium, fairly rich benefits. We have a prime plan that has a small premium. It is actually, I know it to be $22.80 a month at this point. There are a number of plans that are out there in that cost range and maybe even more. They tend to have richer benefits. They say, well, if we're going to charge some premium, we better give you extra dental coverage, extra, a lower out-of-pocket cost. And then we actually have a third plan that's a little unusual for this region. You see them more often in markets like Florida. We have a plan called Saver that actually, not only do you pay no premium, we give you some of your premium, your Part B premium back as a monthly payment into your Social Security check. So we'll give you $50 a month to join that plan, and there the benefits are narrower. You don't get quite as rich a benefit. That's a nice choice for somebody who's healthy, not using a lot of benefits, and says,
right.
I'll take the $50.
Right, exactly. Okay, so copays, do you have prescription? Would I have out-of-pocket costs for the prescriptions that I have generally with an Advantage plan?
Yes, but most plans work on a formulary, and almost all drugs are on most formularies, and it depends on what tier your drug is. So for example, I know Devoted's plan, and I don't know everybody else's, but for Devoted, the top 2 tiers, we charge you pay 0 for your drugs for those. That covers about 66% of the drugs that our members are on. But a typical plan, if you get to tier 3, tier 4, there are some copays that you pay for that.
But
and there's a maximum.
With supplemental plans as well.
Yes. And then there's a maximum amount that you'd spend out of pocket, where after that it would be covered in full for you.
Rich, if I decided that, gosh, this is wonderful, this fits my needs and my husband's needs, we're going to switch to Devoted, what if I change my mind in March of next year?
Well, you can change your mind it depends on what time you make that decision. There's an annual open enrollment period, which happens to be about to start October 15 through December 7, and you can make any choice you want. You can move to Devoted, another Medicare Advantage plan. You could go to traditional Medicare. You could switch from traditional to a Devoted or somebody else. Then those will be effective for January. Between January and through March is what's called open enrollment, as though the first one wasn't confusing enough. Open enrollment is where you say, you know, I think I made the wrong choice. I want to make a switch to a different plan.
I didn't know this.
Yeah.
I don't think I knew that there was a 3-month period where you could switch.
Yeah, you can switch out. You can't go from a Medicare Advantage plan back to traditional Medicare in that window. But what you can do is say, I made the wrong choice. These people aren't treating me the way I thought they would. You know, I didn't realize there's this extra expense. And then you're allowed to make another change. Not a lot of people make a change at that point. And then there's a final thing that can happen in the in-between periods. Like let's say it was June and you moved, for example. So Devoted is only going to be offered in 13 counties in Ohio to get started. Let's say you moved from a county where we are, like you're here in, I think this is Summit County.
Yeah.
If you move from Summit County and you move to Tuscaroras County where we haven't yet opened, you're allowed to make a change even if it were June, July, August, whatever. You could say, my plan doesn't sit here, I need to make a change. So if your life circumstances change, you can change.
I never knew that. I never thought that. That makes perfect sense, that if I did move in or move to Pennsylvania, I would have to change plans.
You might have to. Not all plans would. Some plans might have coverage in Pennsylvania.
But Devoted specifically would not at this time.
Not there.
Moving to Arizona would
Arizona would be nice. Yes, my friend who runs the Arizona plan would love to have you.
Yes, I'm sure. We need to do our homework as seniors. And I think about that every fall, because the advertising, you can't help but think, am I doing the right thing? Are we saving money? Is this the right plan for us? The advertising really does make you a little bit curious about whether you're doing the right thing. If we decide to go from this plan to this plan, I'm thinking we have to do our homework. We really have to sit down and do a cost comparison, don't we?
Yeah, I would say this. I think you're exactly right. It's important to do a cost comparison. It's probably the most normal starting point. I would encourage people to go beyond that. And we can talk a little about how to do the cost comparison in a second, but I would say do the cost comparison and then explore what is the plan going to do for you. So, what we have tried to do at Devoted is think about what is the member experience, what's wrong with healthcare. Healthcare is way too complicated. It's not only too expensive, but it's confusing and it's hard to access, and sometimes you don't even know if you're using the benefits right. So it'd be great if you would explore, I think it's important for your viewers to explore things like, who's going to help me make this easier and simpler? Who's going to take care of my problems for me? It's important to get a good cost-benefit analysis done, but you should also think about what is the whole experience of a plan. I'll put in a little plug for us. So one of the interesting things, I just learned this, is that most American companies have what's called a Net Promoter Score. It's an interesting thing. It was founded by some academics, and they do a simple single question they ask. You're supposed to ask your consumers, would you recommend this company and its products? And you get a score that you're scored between, I think it's between 1 and 10 or 0 to 10. And the 9s and 10s count for you, 6 and lower count against you, and you get an aggregate score of between positive 100 and negative 100. The average health insurance plan scores between 13 and 15 on that scale. Some of them are in the negatives.
Why am I not surprised?
Because health insurance is a confusing product, and it's often not very consumer friendly. Great American businesses like Apple is beloved. It has scores in the 60s. You can have negative scores, so 60 is great. Starbucks, people love their Starbucks. They score in the 70s. Devoted's been rated 3 times about whether it would be recommended by its consumers. 83, 83, 83.
Oh, that's excellent.
So you should look at whether it'll save you money, but you'd hope that it'd be something that the moms and dads of America would say, I recommend.
Yeah.
And so that's one plug I'd put in. In terms of doing the cost-benefit analysis, a great starting point, an unbiased source, Medicare has what's called Medicare.gov.
That's what I was going to ask you about. Unbiased sources.
Yep.
And we have 1 minute.
Oh, okay, so I'll talk quickly. Medicare.gov is a great source for which plans have which doctors and what the copays and deductibles are, that kind of thing. And then I would recommend you talk to a really good broker. And I would ask, do you carry Devoted? Not because Devoted is the greatest company in the world, although it is, but because if a broker is willing to look at a new company, they're probably not just sticking with the old tried and true that they already, I learned these 5 companies, I'm not going to do any more work.
Here it is.
If they'll do the work to learn a new company, they'll probably do the work to help you get to the right place.
Excellent. We need to do some talking at home and just see we just can't keep thinking 1 year after another, it works, it works, it works. And I'd like to explore it, I think, a little bit better. And I thank you for being here. Believe it or not, we have less than a minute left. So Rich, thank you so much for being here and for giving us this information. You've given us room for thought. Thank you.
Well, thank you, Heidi. It's been a real pleasure. It's a privilege to serve the seniors of this country, and they deserve to be treated well.
I couldn't agree with you more. Thank you.
Thank you.
Your information for Devoted Health and for reaching out to Rich will be at the end of this show, so please look at that if you're interested in talking with him. Thank you so much for watching. This is North of 60.